name is Alidra Mickelson, student ID number 2985694. This video is for VTHT 1345, section number 31420. This is my submission for fall 2018 AVMA required video. For radiation monitoring devices, also known as dosimetry badges, there's a couple of different options. There's thyroid levels, there's rings, and there's wristbands. The last two are less preferable because if you're wearing appropriate protective equipment, most likely your glove is going to cover your wristband and it's definitely going to cover your ring. So at my clinic, we use the thyroid badges through Myron Technology. We wear at thyroid level outside of our gowns and outside of our thyroid collars. We don't wear these badges outside. We don't wear these badges throughout the clinic. The only time we wear our badges is when we are either doing x-rays or we're doing any procedure that's going to get us around any radiation. So typically just in our x-ray suites. The way that these work is there's a little piece of film inside of our badge that absorbs the scatter radiation when we're taking radiographs. And we send that to Myron Technologies quarterly. And they send us back an occupational radiation report. Might be kind of hard to read. My name is highlighted here in pink, and our reports are read in millirems. So I have my quarterly amount absorbed was 14. My lifetime amount is absorbed at 135. So maximum permissible dose annually for veterinary technicians and veterinary support staff and doctors is 5 rems per year. And since this is read in millirems, that's going to be a conversion rate of 0.001 millirems per 1 rem. So and as well, annual or lifetime dose is n-18 times 5, n being your age. So I have that worked out here on the back of my page. So 5 rems per year is your maximum permissible dose. And for your lifetime absorbency, n-18, so I'm 22, minus 18 equals 4. Times that by 5, so my lifetime absorbency rate at this point should be no bigger than 20 rems. And again, 0.001 millirems per 1 rem. I had 14 millirems for my quarterly amount this quarter, is 0.014 rems for the quarter, and my lifetime absorbency is 135 millirems, which is 0.135 rems for my current lifetime absorbency. For personal protective equipment in the use of radiology, there are a couple different things. There are radiation protective eyewear, there's lead gowns, thyroid collars, and lead gloves. All of these should be inspected at a minimum every 6 months. And so at my clinic, we take pictures, radiographs of our personal protective equipment to make sure that there's no cracks in it every 6 months. For personal protective equipment we use here at my hospital, here's one of our radiology gloves. As you can see, there's a whole bunch of scratches, teeth marks, so we have ordered new ones and we have those on the way. As for our radiology gowns, we did just get new radiology gowns, the Vet 1 kind that are softer and more flexible. To put that on, you're going to put it on over your shoulders and you're going to strap it behind your back and clip the clip in front. It does have an attached thyroid collar, so we're going to put our thyroid collar on. We're going to get our rad badge and stick that on the outside. And for gloves, you put them on just like so. And you're going to be just like this when you're taking a radiograph, as well as you can use protective eyewear. 3 methods of restraint in veterinary radiology. There's manual, non-manual, and chemical. Manual is when you are using the technician to restrain the patient with appropriate PPE. Non-manual is when you use positioning aids such as sandbags, leashes, gauze, rope, V-trays, foam wedges. There's a variety towels. There's a variety of ways that we can restrain patients non-manually. The other is chemical. That's where we either sedate the patient or we fully anesthetize the patient to take x-rays. For the use of restraint devices in my hospital, we often use it V-trays, so we have these soft V-trays, and we also have harder plastic V-trays. We oftentimes use leashes as restraint devices, so we use those, or gauze to tie around the feet and pull the feet back. And we don't have sandbags currently. We are in the process of getting some, so when we have something that we need to keep forward, we'll roll up a towel and stick a towel behind the leg. So these are 3 positioning devices that we use. Other personal protective Physical barriers that we can use that do not include our PPE is time, distance, and shielding. Time is using the fastest time possible in seconds and doing it right the first time using the lowest MAS. Not only is that better for our patients if we do it right the first time, it's also better for us so that we're decreasing the amount of radiation that we expose as much as possible. So that goes into a LARA as low as reasonably achievable, not only for ourselves but for our patients as well. For distance, and again in time, the phrase that is commonly used is check twice, expose once. In distance, we get in contact with the inverse square law, where if the distance between you and the patient is doubled, that it decreases your radiation exposed by 1/4. So we want to stay as far away from our patients as possible when we take exposures. If we are using manual restraint and we have to be in the room with the patient, we want to be as far away from the anode as possible, and we want to make sure that we look away when we're taking the exposures. And for shielding, if you can leave the room or be behind a lead wall, have your exposure button like on dental radiography, and be away as far as possible, that protects as shielding as well. When taking x-rays, no part of the human body should be in the exposure that's shielded or unshielded. So we don't want to see any fingers, we don't want to see any hands, any arms. No part of the technician or the doctor or any support staff that's helping with x-rays should be in the primary beam, even when we're wearing our personal protective equipment. So if we put a gloved hand in our x-ray, the personal protective equipment is designed to protect us from scatter radiation after it's gone through our patient, gone through all those tissues. It only protects us from 25% of the primary beam when a gloved hand is in the primary beams. As we already talked about, in radiation exposure, we try and go for a LARA, which stands for as low as reasonably achievable, and with that means not having anyone, any extra support staff in the room when you're taking radiation than needed to restrain the patient if you're doing it manually, and nobody in the room if you're using chemical restraint, non-manual restraint. So with that, we don't want to have extra staff in the room, and we want to do everything that we can to keep people out of the room. We should take diagnostic images, do it right the first time like we already talked about, check twice, expose once. Not only are our patients getting radiation exposure, we're also getting radiation exposure. So if everyone does the best that they can, and we do it right the first time, then we're decreasing our exposure and our patient's exposure, since we're the advocates for their patient care. We shouldn't have anyone in the room under 18 years old as part of an OSHA law, as well as any pregnant women in the room, because when we are exposed to radiation, 4 things happen in our cells. We ionize the intracellular water, and that can have permanent effects on the cells when it releases toxins and can alter the way DNA is being made in the cells. 4 things that can happen. Radiation can pass through the cells with no effects. It can pass through the cells with repairable effects, non-repairable effects, or it could kill the cell. So we really want to do everything that we can to protect ourselves, be as far away as possible. Again, with the inverse square law, always wear your PPE. For pregnant women, the first trimester is the time where they're the most sensitive to radiation exposure as the fetus, and they can have one of the most common things that we see is radiodermatitis from chronic low-level radiation exposure. So pregnant women should always go to their management. They should declare pregnancy and discuss with their primary care physician as well as hospital management and get a good plan set out there that works for the both of them per their own discretion. Radiation has effects on multiple tissues. It affects the bones, it affects the eyes, the thyroid, it affects the sperm, it affects the eggs. So we really need to do everything that we can to make sure that we're protecting ourselves. Wear your PPE, use distance again with the inverse square law, do it right the first time, check twice, expose once. Everything that we can do to protect ourselves from radiation, since it is cumulative and we may not see any effects now, but we will likely see effects down the road on how it affects our body. Being in the field for such a long time, the cumulative effects are very important to keep an eye on. To add a patient into X-ray, we're gonna look up the patient by the last 3 letters of the owner's last name and the first 4 letters of the patient's name. We're gonna go right-click New. Whoops. And add in a radiology series.
She's like, I'm freezing to death.
And we're going to be taking OFA hips, and we're going to be taking a cranial caudal radius ulna view. Press OK, and it'll send it over to our X-ray system over here. We're going to go over to our RIS tab, select our patient, tab over. We're going to add our views. We're going to be doing a 4-limb craniocaudal radius ulna, and we're going to be doing a pelvis, and we're going to be doing an OFA, and we're going to estimate he's going to be under 15 centimeters. So we'll do a VD pelvis. Press OK, and that'll pull up all of our images. Okay, to add a craniocaudal radius view, we're going to select K9cc lateral radius ulna and press OK. We're going to select our view. We're going to measure at the patient's leg and the midpoint of the radius and the ulna, and he measures at less than 5 centimeters. So we're going to go over to our measurement chart over here, and on extremities we're going to be an MA of 350, MAS of 250, and a KVP of 60. Closest we have for an MAS is a 2.3, so we're going to go with that. We're going to put our patient in lateral recumbency. We're going to roll up a towel and put it behind his elbow to keep him more straight. We're going to hold his head backwards, and we're going to use our gauze to pull his leg back. We're going to pull the head back and put our gloves on. And we're going to take our exposure. Just going to pull our image up here. And here's an image of a craniocaudal radius ulna. We're going to apply some markers. So that was our right leg. That was a craniocaudal. We're going to add some text that has the patient's name, the hospital's name, and the date of exposure, which is 10/20/18. And we can apply that down here to the bottom of our image. Try and size it down so it's out of the way. There's a labeled right craniocaudal of the radius ulna with the patient's name, hospital information, and the date of exposure. To perform a VD thorax shot on my feline patient here, I'm going to sit her on her back like we would in a VD position and measure with the calipers and see what settings are appropriate for her to be at. So we're going to put her on her back. And we're going to measure with the calipers at the highest point, typically over the rib cage, and she measures at 9 centimeters. So we're going to use our IDEX centimeter chart to make our settings, which is over here on the wall. And for thorax on 7 centimeters, it says an MA of 300, MAS of 1.3, and 1.5 is the closest that we have, and a KVP of 70. So we have our settings appropriate. We're going to put her in this soft taco tray. her appropriately turning the lights off, and I'll turn the light back on to take the shot. So just a second. Okay, so I have her positioned the way that I would like, and I like to go as far away from the x-ray beam as possible. So what I'm going to do is I have her feet tied with gauze to pull her feet back. I'm going to put my gloves on, pull my feet back, and take the exposure. And we're going to come over here to our image viewing system and pull up our thorax image. So here is our VD thorax. Today her microchip is looking like it's in her spine. We are going to crop down the image. And then we're going to apply our markers. Doing this all on the keyboard here, so this is our right VD. We're going to go over to the text box, and we're going to add in our patient's information. Hospital's information. And the date of exposure. And we will put that up in our image at a spot where it's going to be least in the way. Since that's the minimum size we can do. And that completes our VD thorax image on a feline patient. To take an OFA hip shot, we're going to have the patient in VD recumbency, and we're going to roll him over just on his back to measure him. And at the thickest part of his pelvis, he measures at about 10 centimeters. So on our chart here for our pelvis, we're going to have our settings at 300, 2.5, and 65. So 300, 2.3 is our closest, and down to 65. We're going to put him in our soft taco. And position him into the light. We want to have our midline at the ischial tuberosities, and we want to have our end point just below the patellas. I'm going to grab our radiology gloves here. Have it set on our pelvis image. We're going to grab the feet, turn them inward, and give a tight pull, and take our exposure. We are going to label our image. This is our right VD. And we're going to add a text image of the patient's name, the hospital's information, and the date of exposure. Apply that to our image. Down here at the bottom, press OK. And here's our VD OFA quality pelvis shot. Okay, in this video I'm going to show you how to pull up x-rays in our system. We use AVMA and our system is brand new. We just got it about a week ago, and so we haven't figured out quite yet how to have our x-rays attached directly into the patient file. So the way we're doing it currently is going on to VetConnect Plus, which I'll show you now. So you log on to vetconnectplus.com and we do our username and our password, and you sign in. And we're going to go over to the imaging tab on VetConnect Plus. And it'll pull up all the x-rays we've taken recently. So these are x-rays from the last 2 days. And let's see, we can pull up Wrangler. This is a thoracotomy I did yesterday. We did a right cranial lung lobectomy and sent it out for histopathology. These x-rays were taken by myself yesterday with another coworker, and this is a right lateral. We have a labeled BD, and that's how you pull up x-rays in our system. Okay, so for a barium series, this is our patient Groot. He is 15 kgs, and we're going to start at the 5 mils of barium per kilogram of weight for a 60 weight to weight percent. We've already given him 60 mils, so we have an additional 15 to go, and then we'll do 2 images of a lateral and VD an hour apart. So we're going to give his last 15 mils. We're going to administer it right behind the canine tooth and do a little bit at a time so it doesn't come out the side of his mouth. And just slowly so it decreases our risk of aspiration. Good boy, Groody. Okay, and then we will take a lateral and a VD at time 0. Okay, for our lateral image of our barium studies, we have our patient in lateral recumbency. We're going to measure with caliper. And he's less than 15, so we have our system set to appropriate per our IDEX settings. We'll collimate down, get him in position. We'll push him forward a little bit. Collimate down. Stay, Groot. Good boy. Come here, buddy. And your feetsies. Groot, lay down. Okay. Good boy. Okay. So here's our image. We've got our barium here in the stomach. We're going to label it with a right lateral. And we'll add a text that says time 0. We're going to add our patient's information and the hospital's information and the date of exposure. And we'll add that up here since that's where we have space. And that concludes our time 0 image for our barium study for a lateral view. Okay, so we're about to do his 2.5 hour post x-ray. We're going to pull him back into the light. Groody, relax. Groot. Groot, stay. It's okay. It's okay. Alright. Good boy. Stay. Okay, we're going to add our labels. Right, lateral. with our patient's name, time, hospital information, and date of exposure. And there's our lateral image for 2.5 hours.
Hi, my name is Tony Guskey, and I'm an LVT, and I just wanted to let you know that Alidra's strengths in radiology is her knowledge of safety protocol and enforcement. Her weakness is collimation, and her way her knowledge has changed, as is her safety protocol, no longer making sure that her fingers are not in the radiographs, making sure she's wearing the protective gear, and having other people follow the same protocols.